Rubella, another childhood infancy disease. It's not so prevalent nowadays in our developed worlds, thanks to the MMR vaccine, which we'll talk about again in a little bit. Rubella, also known as German measles. Rubella is a Latinized version of the phrase little red, because that's what the rashes we're going to see, that's what the rash looks like. Okay, it's a minor rash. Okay, small little red spots may or may not be raised. That's going to start at the face, the head, and maybe spread down the chest. Why do we have this? Why is this one that we want to fight against? Well, turns out that this is one of the diseases that can actually cross the placenta. So for many women who are in that time, that age of their life, that time frame of their life where they're going to be considering children, they may, your OBGYN or your primary care physician may recommend getting an MMR booster just in case. Because if your immune response, your B cell response to rubella is lagging, there is a chance that you could get a slight infection, and for mom, it's not going to be that bad, but since it can cross the placenta, it will be damaging to the developing fetus. Here's the issue. While for adolescents, childhood, adults, rubella, German measles is not that bad. For most people, it's just a rash that'll go away in a few days, minor complications. Usually those complications revolve around secondary bacterial infections to the rash because people scratch at it, itch at it. Turns out rubella, though, congenital, means in utero, in the uterus, is what is referred to as teratogenic. Causes direct harm to the developing fetus. Mom gets exposed, mom has a few issues that are mild to her, but since the virus crosses the placenta, in the developing fetus, the virus will begin infecting cells. Virus goes in, cells lyse, causing damage. Well, you have to keep in mind, as the fetus is developing, that one cell isn't just going to be one epithelial cell of the skin. It's not just going to be one, cell of a muscle. It could be the originator cell for that entire muscle, all the tissues that will become the muscle and the integument. So if exposure occurs during first trimester, earlier in the first trimester, anywhere actually in their first trimester, the ripples will be extreme. There will be developmental defects. Could lead to miscarriage. Fetus will stop developing, stop sending signals to the mom, and mom's body rejects the fetus. Most common is going to be things that pop up second, third trimester. Deafness, cardiac abnormalities, lesions, mental, physical retardation. It's all caused by what is referred to as rubevirus, rubella virus. Cells that are infected by the virus will not go through mitosis. Okay? Fetal development, that's pretty much what every cell is doing, going through mitosis, so that you go from just a few hundred, few thousand cells to the few trillion cells that you are when you are born. Not only halting mitosis, but it can induce apoptosis. If it's the cells and the tissue have advanced far enough in their development that certain signaling cues within the cell are now developed, well, surrounding tissues may tell that viral infected cell you need to die. Well, that could alter the trajectory of that developing tissue, could alter how that tissue continues to grow and increase in size, which is what third trimester is really all about for most of the cells and tissues and organs. We're going to find this worldwide. This is not well, you're going to find it in one place, or it's only going to happen in one people. No, this is everywhere. Okay? Majority of exposure is going to be respiratory secretions, human to human. There have been some reports that the virus can be excreted in urine. So it's going to be sewage, contaminated water. May also be another exposure route, but that's very low numbers. There are many other things to worry about if your water source is fecal contaminated. Within hours, days, depending on who you're reading, of being infected, patients can actually start shedding the virus. So before the rash even occurs, when the patient is in that prodromal stage, okay, remember, that's the incubation period and things like that. Incubation up through disease, prodromal, all of this, that patient can be shedding the virus. Thankfully, the ability to transmit this person to person, what they call being communicable, is actually very low. It's actually hard to pass this one person to person, but it's still there. And because we don't want this bouncing around in our populations, due to, well, for childhood, adolescents, adults, it's a minor thing. Infants and the developing babies, the fetuses, are what are hit the hardest. That's why we developed the vaccine for this. And we've, gotten rid of this one rather well here in not only the US, but the Americas, North and South America, through vaccines. Hard to diagnose, okay? The German measles, rubella, that mild rash that you can get, gonna have to go through and do some antibody testing. Has this person been exposed? Could this be what's causing? Best treatment is prevention, though. MMR vaccine during infancy. No treatment for congenital. Basically, it's going to be, if it's still in utero, nothing you can do. If it's postnatal, remember, postnatal means after birth, you see some issues due to mom having a rubella infection. By this time, there's nothing that can be done. It's going to be minimize damage and palpitative, see what can be done to take care of any issues. Maybe there's going to have to be some physical as well as mental therapies later.